So we have a lot of bispecific antibody in development. The only one drug we have currently approved is called Amivantamab. I'll show you the data for that in a second. But we have different antibodies in development. And so second column is you see what two things is the bispecific brings together. For example, zenocutuzumab is going to bring HER2 receptor, and HER3 receptor is currently being developed in a very rare molecular disease, which is called NRG fusion. Then you have ivonescimab, which is currently being developed in lung cancer for patients who have mutations and don't have mutation. That brings PD-L1, which is an immune receptor, as well as VEGF, which is a blood vessel receptor. And then the one that we are very excited about is tarlatamab, which is developing for small cell, and it basically brings the immune cells. That's why CD3, it's a receptor on the immune cells, and DLL3, it's a receptor on the cancer cell. So it basically forces the immune cell to attach to the cancer cell. And then we have other ones, which is combining two immune molecules, like PD-L1, as I already mentioned, it's an immune molecule, as well as TIGIT, which is another immune molecule. And then you have a PD-L1 and CTLA-2 in the last example. But again, the only drug we have approved in lung cancer is Amivantamab. And so this is the data behind Amivantamab. So what is Amivantamab? It's a bispecific antibody. I showed the cartoon on the right side of the slide. One part of the antibody attaches to MET, which is a receptor in a cancer cell, and another antibody attaches to the EGFR, which is also a receptor on a cancer cell. Currently, Amivantamab is only approved for patients with a very rare mutation in lung cancer called EGFR, exon 20 insertion, and this is the results of the study. It showed 40% of the patients responded about 8.3 months before the cancer progressed, and the median overall survival in that study was 22.8 months. So in summary, we are very excited. We are looking forward to have approvals of two new classes of drugs in lung cancer, and those are called antibody drug conjugates and bispecific antibodies. Currently, we only have two drugs which are FDA approved, which I mentioned, trastuzumab deruxtecan, which is antibody drug conjugate for a rare molecular subtype, which is a HER2 exon 20 insertion, and amivantamab, also for a rare molecular subtype, which is EGFR exon 20 insertions. And of course, I'm always hoping to have more medications approved in that space. Thank you so much.